The 8 signs on breast you should not ignore. Today we are going to explain a lot concerning the breasts, breast cancer, breasts, inches, and the thing that goes on breast. So every woman need to understand what is happening on her breast, nipple, or anyone, so that for you to understand when there is problem or when there is no problem. And today class we are going to introduce to you Dr. Simi. Dr. Simi, she's the one, a very trained practitioner into doctrine and a gynecologist. She's the one that will explain a lot concerning this issue concerning breasts. 8 signs about breasts that you should not ignore. Try to watch the video to the end and like, subscribe, and share it to everyone to see. Thank you for watching.
Your breast is fascinating. It sits on your chest wall and it changes throughout your life in response to your hormones. So it changes during puberty, your periods, pregnancy, breastfeeding, and the menopause. In this video, we're going to talk about 8 signs on your breast that you shouldn't ignore. Before we start, are you able to name all of the parts of your breast? Here's the roadmap. Can you find your way? Your breast is shaped like a teardrop. The raised projection at the front is the nipple. The darker circle around the nipple is the areola. And those small bumps that you sometimes see around the areola are oil glands, also known as Montgomery glands. This is the body of the breast and the tail, which points towards the armpit. So the breast actually sits diagonally like this and not like this, how it's commonly portrayed. And finally, the crease at the bottom where the breast meets the chest wall is called the breast fold. Now, let's talk about those 8 signs that you shouldn't ignore. Okay, so first let's start with the inverted nipple. This is when the nipple points inwards or is folded like a horizontal crease, and it's actually quite common. Some people have had an inverted nipple all their life and it's usually nothing to worry about. In fact, in some situations it can come back out. But if you develop a new inverted nipple, you should see your doctor. Flaky rash. A flaky rash around the nipple or areola may be a sign of an underlying issue. The rash can be itchy, red, sore, cracked. It can spread outwards and it can even be weepy. So it can look like nipple eczema, but it may be more than just a skin issue. Tethering. Tethering refers to the pulling in or drawing in of the skin, making it look like there's a dent in the breast. And it can be more noticeable when you raise your arms above your head. It could be a sign of an underlying problem in the breast, so don't ignore this. Dimpling. This is where the skin of the breast has multiple dips, so it kind of looks like the skin on an orange. And that's why it's called peau d'orange sign. I hope my French pronunciation is not too bad on that. So it happens because of thickening and swelling of the skin, which then accentuates the pores. If you see this change, please have it checked out by your doctor. Redness or heat. Feeling an unusual warmth in your breast or part of your breast could be a sign that something is not quite right. Because the warmth can be associated with tenderness or redness, it can sometimes feel like an infection. In women who are breastfeeding, it is not uncommon to have a single hot breast which is painful and red, and this is called mastitis, and it's due to the fact that bacteria can manage to enter any sores or cracks that have developed around the nipple from breastfeeding. It is more concerning though if you develop a red sore breast when you are not breastfeeding. Nipple discharge. Nipple discharge, meaning fluid coming out of the nipple, can be due to various causes, and this nipple discharge can come in a variety of colours, which can sometimes give a clue as to what the underlying cause may be. The discharge can be yellow, green, milky, white, clear, or even blood-stained, and it can affect one or both nipples. Sometimes it's spontaneous, meaning that you might just take off your bra and then you see that there's a stain inside, or it can occur only if the nipple is squeezed. Don't ignore this sign, especially if it's from one side only and you are not pregnant or breastfeeding. Change in size. Our bodies are naturally asymmetrical, and many women have uneven breasts, meaning one side is usually a different size or shape to the other. And this can be completely normal. However, if one of your breasts suddenly changes size or shape, don't ignore this. A breast lump. Breast lumps are relatively common and they can feel different to your normal breast tissue, so they can feel quite firm or hard, smooth or irregular, and if you try to move them, they can sometimes be mobile or fixed. And it can be quite hard to know if you're feeling a lump, because sometimes breasts are quite lumpy, especially in the upper and lower outer parts, and especially in the 2 weeks before your period. So the best time to feel for a lump is a few days after your period has ended. Now, Not all lumps are harmful, but if you do find a lump, it's crucial that you get it checked out. A persistent lump in the armpit or around the collarbone could also be a sign of an underlying problem in the breast. These 8 signs that I mentioned don't always mean that there's something wrong, but sometimes these signs we talked about could indicate a breast cancer. If you notice any of these 8 signs in your breast, don't panic, but do make an appointment to see your doctor. If you want more information, check out the links in my description and check out my colleague, Dr. Liz O'Riordan. She's a breast surgeon, an author, and has had breast cancer herself, and she makes the most incredible content on breast cancer and breast awareness. If you learned something new, leave the graduation emoji and tell me what it is in the comments.
In today's video, I'm going to be using this diagram to fully explain most of the possible causes of you not getting pregnant yet. This video is for those of you that have been trying to get pregnant and it has been unsuccessful. In today's video, I'm going to be telling you all of the reasons or all of the common reasons why you have been trying so hard to conceive and it's been unsuccessful. And I am going to be telling you all of the tips and secrets on how you can overcome all of these challenges in order to get pregnant. If you are new to my channel, this is all I do. I talk about infertility and the treatments, the solutions, how you can help yourself when you should see a doctor. I am Dr. Amarachi Ijoma, so if this is the kind of content you are interested in, keep watching. So ladies and gentlemen, this is the uterus, and in today's video I'm going to be using this diagram to fully explain all the possible causes of, or most of the possible causes of infertility, most of the possible causes of you not getting pregnant yet. So this is the vagina. This is usually where the penis deposits sperm, just around this area. So this is the vagina. This is the cervix. So this whole area here is the neck of the womb. It's called the cervix. It's the neck of the uterus. This is usually where the baby comes out from. It's usually closed until labor. When the baby is about to come out, then it dilates. It opens up for the baby to come out. The baby passes through the cervix, into the vagina, and out into the environment, into your hands. So these are the ovaries, and the little circles you're seeing, the little dark circles you're seeing on the ovaries are called follicles. They are like sacs of fluid, sacs that contain water, like fluid-like substance that contains the egg. So on the ovaries, or rather in the sac of fluid, in the follicle, the egg is suspended in the fluid. And these red dots you're seeing here are the eggs. Then you have the fallopian tubes. These and these are your fallopian tubes. So this whole area you're seeing here is actually the uterus. Every other thing that I've mentioned right now are other organs that are connected to the uterus. And then we call this place the cavity of the uterus. This is usually where the baby lies. So now that I've brought you guys up to speed with what the uterus looks like, what your reproductive organs look like, now let's get down to business. For pregnancy to occur, a sperm must meet an egg. So fertilization will occur when this happens, and then a baby will be formed. So for this sperm and this egg to meet each other naturally, sexual intercourse must occur. So this is what happens when you have sex. The penis enters the vagina and then deposits the semen into the vagina. So these are sperm cells from the semen. Because what you actually see when a man ejaculates is actually called the semen. The semen is the fluid that you see when a man ejaculates. But inside that semen, there is sperm, but you can't see the sperm. The sperm makes up only 5% of the entire semen, and you cannot see it with your naked eye. So now, even though I said 5% of the entire semen, that 5% amounts to millions of sperm cells. And guess what? We only need one sperm cell to fertilize the egg. So the journey begins from here. Then they start to enter through the cervix into the uterine cavity. So these are the sperm cells still moving. It's usually like a race, but only one is going to get to the egg. It's usually the fastest one that will end up getting to the egg. For an egg to be released, ovulation has to occur, and ovulation is simply release of a mature egg from the ovary into the fallopian tube. So now in this case, this egg has been released a follicle grew so big and then ruptured, and then the egg has been released, then this is the fimbriae, like the hand of the fallopian tube, which will pick up the egg, and then the egg will migrate all the way to this place. And then waits for the fastest sperm to come and fertilize it. Then when this sperm gets to the egg, fertilization is said to occur. Now, when fertilization occurs, this becomes the zygotes. Then it then takes about 5 to 6 days for the fertilized egg, which is the zygote, to actually journey into the uterine cavity, and then when it gets here, it implants. So implantation usually occurs inside the uterine cavity. So this is your implantation. So if fertilization is this straightforward, why are you not getting pregnant? There are several reasons that can prevent fertilization from occurring and hence prevent pregnancy from occurring. Let's start with the sperm. If the sperm is not able to do all of these things that I talked about, then it's never going to be able to meet the egg, and then fertilization would never occur. So what can cause the sperm to not be able to meet the egg? One, if a man has low sperm count. Sperm count is said to be normal when a man releases at least 20 million sperm cells per mil of a particular ejaculate. Some experts say when a man ejaculates at least 15 million sperm cells per mil of a particular ejaculate. But how do you know how many million sperm cells that you have ejaculated? That's easy. You have to do what we call a semen analysis. You go to the lab and then you produce your sperm via masturbation into a container, and then the lab scientist runs the test for you. Also, remember I said that it's like a race. Only the fastest sperm is going to fertilize the egg. So if the sperm cell is not fast enough, that is, if its motility is reduced, it can also prevent fertilization. Sperm has a particular shape, so if the shape of the sperm is distorted, then it could be a genetic or a DNA problem, and then it's going to also affect the chances of the sperm actually meeting the egg for fertilization to occur. So when you're not getting pregnant due to a problem with the sperm, there's actually solutions for it. First, you will need to find what is the cause of my sperm being abnormal. So I'm going to be mentioning some lifestyle habits that studies have shown that affects the sperm. We have smoking, excessive drinking, excessive weight gain, excessive weight loss, heat around the testes, and this could be gotten from placing your laptops directly on your thighs while working, or visiting the sauna very frequently. Sauna is an enclosed space where the temperature is set to be high for various reasons, but this sauna can actually affect your sperm production. Also, there are other causes like genetic abnormalities, DNA problems, even certain medications. For example, antidepressants. If you're on antidepressants, it can actually cause low sperm counts. So if you have been able to identify your lifestyle habits that can potentially affect your sperm production or sperm motility or sperm shape, then you have to try to address those causes. If it is the sauna that you visit frequently, or you're always in a jacuzzi, a hot jacuzzi, then you have to stop. And if you stop, you will notice that within 2 to 3 months, your sperm count will return to normal. It will increase again. And this is because it takes about 3 months for the sperm to be produced in the body. And also, research has shown that when men stop going to the sauna, or stop entering the hot jacuzzi, or stop putting their laptops directly on their thighs, within 3 months, the sperm count returns to normal or simply increases. There are also prenatal supplements for men. Yeah, it's not only women that take prenatal supplements. So some men take prenatal supplements, and these supplements help to actually increase the sperm count and help with the sperm health in general. But this is not absolute. So some men may use these supplements and it will help with their sperm health, and for others it wouldn't. So like I said, you need to visit a specialist to find out what the cause of your sperm abnormality is. So while shopping for that supplement, there are 2 important ingredients that you should look out for in a male prenatal vitamin, and they are zinc and CoQ10. Several studies have shown that CoQ10 helps to improve the movement of the sperm. That's the motility of the sperm cell, how fast your sperm can swim to get to the egg. And then for zinc, it's not just the movement that is improved, even the sperm count is improved. So if you want to know other ingredients to look out for in your male prenatal vitamins, I'm going to put the link to a video where I talked about male prenatal vitamins and all you should look out for in a male prenatal vitamin. So another reason you may not be getting pregnant is, as a woman, remember I said this is the neck of your uterus. This is where the baby comes out from, and it's usually closed until during labor. Also, it slightly opens during menstruation so that the blood coming from here can actually come out. On the cervix, some women have what we call a growth. This growth is called a polyp. And sometimes the growth is like this, big enough to block the cervix. Most times you don't have any symptom when you have a polyp, so it's usually during a routine vaginal examination that your gynecologist may just stumble upon it and be like, oh, you have a polyp. But for some women, they have excessive bleeding and long duration of bleeding. So it's important that I mention that polyp doesn't always cause infertility. It can sometimes cause infertility. And the treatment to this is simple. During that vaginal examination, when your gynecologist stumbles upon it or your healthcare provider stumbles upon it, what they do is they just do a minor procedure to take it out. If it is a smaller polyp, they'll just use a forceps to twist around the stalk and take it out. And then it's usually an outpatient procedure. You go home the same day and you're fine. So I know that my uterine cavity, where the baby is supposed to lie, I know that I have drawn it as this wide space. Yes, it's a space, but it's usually collapsed on itself. So imagine there is an injury or an inflammation in this cavity. And remember I said it's collapsed on itself. Then when it's healing, it will heal together and then fuse together. We call this adhesion. And one of the causes of uterine adhesion is untreated sexually transmitted infections. So again, you can prevent sexually transmitted infections simply by avoiding multiple sexual partners or using condoms. When you use condoms during sexual intercourse, you protect yourself. So your question may be, but the penis cannot get all the way into the uterine cavity. So how is the sexually transmitted infection causing injury to my uterine cavity? The explanation is, even though the penis stops here, once the infection starts from this area, your vagina. But one thing about sexually transmitted infection is that it can ascend. It will go through the cervix into the uterine cavity. Sometimes it even gets all the way to the fallopian tube. So it doesn't only cause injury and scarring in your uterine cavity, it also causes injury and scarring in your fallopian tube. And if this happens, sperm cannot get into the uterus, because remember, the scarring has caused it to heal on itself. So now this space that the sperm is supposed to go in through is now closed up due to the adhesions, due to the scarring, and then fertilization will not be able to occur. Because remember, the egg is usually here. When the egg is released from the ovary into the fallopian tube, it's usually here. So if the sperm cannot pass here because there is scarring and no space for it to pass, or let's just assume that the scarring didn't occur here but went all the way here, the injury here was so severe that the scarring occurred here, even if the sperm gets into the cavity, it wouldn't be able to pass into the fallopian tube and get to the egg, so pregnancy will not occur. So the treatment depends on the type of STI. So we have the bacterial STI, which is the chlamydia, the gonorrhea, the syphilis, and then we also have the viral STIs. So treatment depends on which it is. So again, you have to visit your healthcare provider so that you can be properly evaluated and the cause of the infertility is found. If it is a bacterial STI and your healthcare provider catches this early before any major damage is done, then treatment, once you do your complete course of antibiotics, you're good to go. You'll be completely healed and it shouldn't affect fertility. But if complications have already occurred, that is injury and scarring, you will still get treated with antibiotics to prevent further damage, but then you will still need your healthcare provider to perform a procedure that will help to open up the uterine cavity if the scarring is limited to the uterine cavity. But if the scarring has gotten all the way to the fallopian tubes, we'll get there and I'll explain that to you. But if it is a viral STI, there are some viral STIs that have treatment, and then there are some viral STIs that have management. That is, it cannot be completely treated, but it can be managed. For the ones that can be treated, for example, human papilloma virus, there are treatments like cryotherapy or LEAP, but for the ones that can be managed, they will be managed. Another cause of infertility that can happen in the uterine cavity is actually fibroids. But this one is interesting because not all fibroids cause infertility. Fibroids is actually very common. Out of every 10 women, about 2 to 8 women will have fibroids, and they'll go on living a normal life. It's not a death sentence. People with fibroids have gone on to give birth to multiple children. They've gone on to live to their old age, and most times you wouldn't even have any symptoms. Now, fibroid might now become a problem if you have symptoms. For example, if you're bleeding for a long time, normal bleeding duration is 2 to 7 days. But when you start bleeding for 14 days, 21 days, 58 days, that is a common symptom of fibroids. And then that's an alarm. You go and see your healthcare provider. Now, when are we concerned about fibroids with regards to fertility? There are 3 locations on your uterus that fibroids can occur, and I should actually define what fibroid is. It's a growth. It's not cancerous. It's not a cancer type of growth. But it's a benign growth. That is a growth that is not cancerous. So it's a growth that arises on the muscle of the uterus. Remember when I shaded these parts of the uterus and called it the muscle? Yes. That is where fibroid usually grows. When a fibroid occurs on the inner wall of the uterus, for example, here, it's called a submucous fibroid. But when the fibroid occurs within the muscle of the uterus, it's called an intramural fibroid. And when it occurs on the outer wall of the uterus, it's called subserous fibroid. So when this fibroid occurs on the outer wall of the uterus, like this subserous fibroid here, or within the muscle of the uterus, like the intramural fibroid, we are not worried about infertility. Now, when the fibroid occurs on the inner wall of the uterus, then we might be worried. Now, I say might because not all the time. So why are we worried about a fibroid occurring on the inner wall of the uterus? That's because, remember I said that this zygote, this fertilized egg here, is going to actually journey for about 5 to 6 days and come here to implant. Remember that this was our implantation, right? So imagine that the zygote, the fertilized egg, was trying to come and implant somewhere here, but this fibroid is already taking the space that it wants to implant. Then infertility might occur. But remember, you have 2 fallopian tubes and you have 2 ovaries, so fertilization can occur on either side. But then again, this zygote, this fertilized egg, when it travels on the 6th day, it mustn't be here that it will decide to implant. It can look for anywhere, implant here. It can look for anywhere, implant here. And another thing is, remember you have 2 fallopian tubes. You also have 2 ovaries. So ovulation, that's the release of mature egg, can occur anywhere. So if the ovulation occurs here and then the fertilized egg travels all the way, it can decide to implant here, it can decide to implant here, it can decide to implant anywhere. So how this submucous fibroid can prevent you from getting pregnant is if it prevents implantation. That is, where the embryo decided to fertilize, that's the place that it decided to stay, then it can prevent fertility. Another thing is, sometimes even when implantation occurs here, studies have shown that pregnancy hormones have been implicated in increase in size of this fibroid. So imagine your baby is growing here and is growing and growing. and growing, and your fibroid is growing at the same time, at some point there will be no space. And if there is no space, it can prevent the baby from growing the way the baby is supposed to grow, and can lead to complications like death of the baby inside the womb. So that's the reason when a woman with submucous fibroid gets pregnant, she's followed up more frequently than a woman without submucous fibroid. That is, for antenatal care, if other women without submucous fibroid or without any other complications are going once every month, a woman with submucous fibroid will be asked to come more frequently, depending on the doctor's evaluation. So bear in mind that it's not every time that the fibroid grows, and sometimes it doesn't even grow at a fast pace. So pregnancy can occur till term, till 9 months, and delivery can be successful. So when next you're diagnosed with fibroid, you need to ask your healthcare provider, what is the location of this fibroid? What is the size of this fibroid? So like I said, you may not even need treatment, but if you do need treatment is simply surgical removal of this fibroid. Research has shown that a lot of women with fibroids are vitamin D deficient. So if a lot of women with fibroid are vitamin D deficient, if we give these women vitamin D, will it reduce, will it shrink, will it help with the treatment of fibroids? This brings me to other studies that have shown that in the lab, vitamin D was introduced to fibroid cells, and it actually helped to reduce the size of these fibroids.